Greetings from Accord Super Specialty Hospital, Greater Faridabad. I am Dr. Divya Kumar. I am an obstetrician, gynecologist, and an infertility specialist. And the topic for discussion today is fibroids. What are fibroids? Who all are more predisposed to developing a fibroid? Why does it develop? What are the signs and symptoms? And what are the treatment of fibroids? So, coming to the first part, what are fibroids? So, fibroids are benign or non-cancerous lesion, and they develop in the uterus. So, there can be different sites. They can develop inside the wall of the uterus. They can develop inside the cavity of the uterus. They can develop on the outer side of the uterus. But these lesions, they are non-cancerous or benign lesion, as we say, and they are like excessive growth of the muscular tissue which are in the wall of the uterus. They are the normal tissue, but the growth becomes excessive so that they form a nodule kind of thing, and that is called as fibroid. So fibroids can be of different sizes. They can be their number can be different, their site can be different, and depending on these, the symptoms, their presentation can be different. So first, let us discuss who all are more likely to develop fibroids. So why does it develop? We don't know the exact etiology, but certain hormonal imbalance makes you more predisposed to get a fibroid. So usually these are the hyperestrogenic conditions where we see more of fibroids. Somehow it is seen that it has a racial variation as well. Like in black women, it is more common. There is a genetic predisposition also when you have fibroids running in your family, like your mom or your grandmother or your maternal aunt having a fibroid, then you are more likely to develop it. Sometimes it is related to obesity also, and in some studies, some certain types of diet have also a predisposition to develop fibroids. Now, coming to the signs and symptoms. So most of the fibroids, they are usually found in the reproductive age group women, and if we screen like all of them, then 75 to 80% of women will be having some size or some form of fibroid. So it is very common, and they are asymptomatic, like they don't have any symptoms, they're just silent, they're just sitting there. But sometimes they present with certain symptoms, certain problems, and mostly they are related to menstrual irregularities in the form of either excessive bleeding or prolonged bleeding or passage of clots during bleeding, or sometimes bleeding in between periods. Sometimes they present as a dull ache in the lower abdomen. Sometimes they present as urinary complaints, especially when the fibroid is lying just on the interior wall, in front of the uterus, because this is the area where the urinary bladder lies. So it can present as urinary symptoms. Sometimes these fibroids can present on the back side of the uterus, and then on the back side the rectum is there, so you can have constipation, or you can have difficulty in passing the stool, so it can present like that also. Sometimes it presents as in the form of difficulty to conceive, that is infertility or subfertility, because of the site of the fibroid or maybe the size of the fibroid. So if you are having all these things, then you must see your gynecologist. You might be harboring a fibroid. And coming to how can we diagnose a fibroid? So the first thing is, depending upon your history, your symptoms, we can diagnose. Then we can diagnose on the basis of the internal examination or the pelvic examination we do generally in our OPD. So while doing a pelvic examination, if we see an enlarged uterus or uterus with irregular contour, irregular surface, then it is more likely you're having a fibroids. And coming to the confirmation part, usually most of the time we are able to pick the fibroids on ultrasound, or it can be a trans-abdominal or even a trans-vaginal ultrasound. Trans-vaginal is the preferred route because we are lying much closer to the uterus and the adnexa, so we can have a much better picture of the whole area. But some fibroids, which are very large, can be seen easily on a trans-abdominal ultrasound. Other modalities can be MRI or even hysterosalpingography, where we can easily see a fibroid which is lying inside the cavity of the uterus, or even saline sonography, where we can saline sonohystrography, where we put a dye and we do a scan, and simultaneously the fibroid which is lying here inside the cavity is outlined. So these are the normal modalities we diagnose fibroid. Now coming to the treatment part. So the treatment again depends whether the patient is desirous of childbearing, or she has completed a family. Also, it depends upon the age of the patient, where she is married, unmarried. We have so many options, starting from expectant treatment, or where we just wait and watch. We are watchful about the size of the fibroid and the growth of the fibroid, mostly in cases where there are no symptoms. Then comes the medical management. There are so many medicines which we can give, though none of them have proven to shrink the size of the uterus or to treat them for the definitive treatment of the fibroid. But still, we have certain medicines which we can use to control the symptoms of the fibroids, because of the fibroids. Then there are surgical interventions are also there. In the surgical intervention, we have surgeries where we might take the fibroids only, or definitive surgery where, because fibroid is one thing which recurs once we take out the fibroid, but the uterus is there and you are genetically or racially more predisposed, then you might develop a fibroid again. So sometimes it is patient's choice, and maybe the patient is in that age group that they opt for a definitive treatment. So a definitive treatment is hysterectomy, that is taking out the whole of the uterus. There are other modalities also. We treat with high frequency sonography or MRI directed ultrasound sonography, or even we embolize the fibroid. So these are the other modalities. So if you are, just to sum up the whole thing, if you are suffering from these symptoms, either it is some kind of menstrual irregularity, or a pain lower abdomen, or a dull pain in your back, or some urinary symptoms, or some symptoms while passing your motion, or even you are trying for a baby, and you are not able to conceive, then these can be symptoms of underlying fibroids. So don't shy, just go and see a gynecologist and take care of yourself.